Now we'll talk about the musculoskeletal system. When you examine this musculoskeletal system, you assess the bones, muscles, and joints that support the body and allow movement. You also evaluate the system that protects vital organs, produces red blood cells, and stores essential minerals. To help you assess this versatile system, this program will show you how to perform a complete musculoskeletal examination. Throughout the exam, you'll see normal findings. Bear in mind that you may see these findings, normal variations, or abnormal findings in your practice.
Before examining the musculoskeletal system, consider its anatomy. The skeleton is made up of 206 bones. Many of them are connected by joints, which allow mobility. Non-synovial joints unite bones by fibrous tissue or cartilage. They may be immovable, like the sutures in the skull, or only slightly movable, like the vertebrae. Synovial joints are freely movable. They separate bones from each other and are enclosed in a joint cavity, filled with a lubricant called synovial fluid. In these joints, cartilage covers the surface of opposing bones. The joint is surrounded by a fibrous capsule and is supported by ligaments. A bursa is an enclosed sac filled with synovial fluid. Bursa are found in potential friction areas, such as the knees and shoulders. Skeletal muscles contract to produce a wide range of movement.
So if you'll take a seat on the table, we can begin the exam.
During the musculoskeletal examination, plan to use this order to assess each joint. Inspect the joint and skin, noting joint size and contour and skin color and characteristics. Palpate each joint, including its temperature, muscles, bony articulations, and joint capsule. Test range of motion to detect any limitation. Test muscle strength by applying an opposing force as the person performs range of motion. With the person seated, examine the temporomandibular joint. Inspect the area anterior to the ear. Place your fingertips in front of each ear and ask the person to open and close his mouth.
Now I want you to open your jaw as wide as you can.
Now ask him to open his mouth maximally. Normally, the space between the upper and lower incisors is 3 to 6 centimeters.
Good. Now I need you to open your mouth partially and move your jaw from side to side.
Then ask him to open his mouth partially and move his lower jaw from side to side. Normally, he can move it 1 to 2 centimeters.
Now open your mouth partially.
Also ask him to stick out his lower jaw. It should protrude without deviation.
Now I'm going to examine the muscles of the jaw. I need you to clench your teeth.
With the person clenching his teeth, palpate the temporalis and masseter muscles. Compare the right and left sides, which should be the same in size, firmness, and strength.
Good. Now I'm going to be checking the strength of your jaw muscles. Going to touch your face.
Ask the person to move his jaw forward and laterally against your resistance, which he should be able to overcome.
Good. Now I need you to sit up straight so I can examine the head and neck
Inspect
areas.
the person's head and neck alignment. The cervical spine should be straight and the head erect. An older adult's neck may show an increased concave curvature and a backward head tilt to compensate for spinal kyphosis.
Now I'm going to lower your gown. Tilt your head forward just a little bit, please.
Palpate the spinous processes and the sternomastoid,
Good.
trapezius,
Good.
and paravertebral muscles. They should feel firm and non-tender.
Now I'm going to check the mobility
Next,
of your neck.
check
We're gonna do
range
this
of motion
having you
by
move your
asking
head
the
in a
person to
different
move his head in different directions. you should see flexion of 45 degrees,
I want you to
extension
put your
of
head back as far as
55
you can.
degrees,
Tilt your head to the right as far as you can.
lateral bending of 40 degrees
And to
to
the
the
left.
right and left,
Now turn your head to the right as far as you can,
and rotation of 70 degrees to the right and left.
and to the left.
Each movement should be smooth and controlled.
This time we're going to do it with some resistance.
Test muscle strength by applying resistance as
Turn
the
your head to the
person
right.
repeats these motions. He should be able to resist your hand pressure
And to the
equally in
left.
all directions.
Good. Now I'm going to take a look at your shoulders.
Inspect the shoulders posteriorly and anteriorly, checking the joint's size and contour, and the shoulder's bony landmarks. You should see no redness, atrophy, deformity, asymmetry, or swelling. Next, palpate both shoulders, starting at the clavicle. Explore the acromioclavicular joint, subacromial bursa, greater tubercle of the humerus, glenohumeral joint, biceps groove, and scapula. You should detect no muscle spasm or atrophy,
tenderness?
swelling, heat, or tenderness.
Okay.
Now test shoulder range of motion by asking the person to perform 6
I'm going
movements.
to examine the range of motion.
Cup your
of
hands over
shoulders.
his shoulders
My
to
hands
detect
on your
crepitus,
shoulders. I
which
want you
should
to
not
raise
be
your
present.
arms above your head.
During range of motion testing, you should see forward flexion of 180
Down.
degrees.
Good. And take your arms behind you as far as they can go.
Hyperextension up to 50 degrees.
Good. Now I'd like you to take your arms, reach behind your back, and try and touch your shoulder blades with your hands.
Internal rotation of 90 degrees.
Good. Now take both arms, raise them up above your head, and put your palms together.
Abduction of 180 degrees.
Now take your right arm. As you lower it, sweep it across the front of your body as far as
Adduction of 50 degrees.
Good. And the left. Good.
And external rotation of 90 degrees.
You can have a seat on the table. We're going to continue with the evaluation of the strength of your shoulders.
Then test the
hands
strength
on
of
your
the shoulder
shoulders,
muscles
and I want you to
by
shrug
having the
against
person shrug against your resistance, which he should be able to overcome.
Good. Now we're going to examine your elbow.
Inspect the elbows in the extended and flexed positions, particularly noting the olecranon bursa and olecranon process.
Good.
You should see no deformities, redness, or swelling. With the person's elbow relaxed and flexed about 70 degrees, use your thumb and fingers to palpate the olecranon process and the medial and lateral epicondyles of the humerus. Normal tissues and fat pads should feel fairly solid. They should have no synovial thickening, swelling, nodules, or tenderness. Also palpate the olecranon bursa, which normally is not hot, swollen, or nodular.
We're going to continue on with the exam and check your range of motion of your elbows. I want you to
Then
take your
test
right
range
arm,
of motion
bend
by having the
it into
person
your
perform elbow
and
movements.
straighten.
You should see flexion of 160 degrees, extension at 0 degrees,
And same with the left. Good. Now I'd like you to put your elbows at your side, hands out in front of you. I want you to place
pronation
palms
of
down.
90 degrees, and supination of 90 degrees.
Now I'm going to check the strength in your elbows.
To test muscle
I want you
strength,
to resist.
stabilize the
pull.
person's arm with one hand.
Now push.
Then have him flex his elbow against your
Same on this
resistance.
side.
Also ask him to extend his elbow against your resistance.
And then
He should be able to overcome it.
good. Now I'm going to check your hands and wrists.
Inspect the wrists and hands. Normally, the wrists are in slight extension. The fingers lie in the same axis as the forearm, and no swelling, redness, deformities, or nodules are present. The skin should look smooth with knuckle wrinkles and full muscles. Note the thenar eminence, which should be a round mound on the palm next to the thumb. Now support the person's hand with your fingers. Relax and straighten his wrist, and palpate it firmly from side to side with both thumbs. Normally, the joint surfaces feel smooth, with no swelling, bogginess, nodules, or tenderness. Palpate the metacarpophalangeal joints with your thumbs just distal to and on either side of the knuckles. Then, using your thumb and index finger in a pinching motion, palpate the sides of the interphalangeal joints. Normally, no synovial thickening, tenderness, warmth, or nodules are present.
Now I'd like you to put your arms at your sides.
Next,
hands out in
test
front of
range
you.
of motion by asking the
want you to
person to
follow my
perform
movements.
wrist and hand movements. You should see wrist extension of 70
Put your
degrees,
fingertips up, flexing your hands upward. Hands
wrist
down,
flexion of 90 degrees,
and hands all the way down, pointing to the floor. Good.
finger hyperextension of 30 degrees at the metacarpophalangeal joints, finger flexion of 90 degrees,
Now, keeping your arms at your side, I want you to try and turn your wrists
ulnar deviation of 55
outward.
degrees,
to the middle,
radial deviation of 20 degrees,
to the middle, and spread your
and
fingers.
finger abduction of 20 degrees.
Good. Now I'd like you to make a fist with each hand.
Also, ask the person to make a tight fist,
Good. Now I'm going to have you touch the thumb to the tip
and
of
then
each
touch the
finger
thumb to each fingertip
and the base.
and to the base of the little finger. The response should be equal bilaterally.
Good. Now I'm going
For
to
muscle
rest your
strength
forearm on your
testing,
leg. Flex
stabilize the person's supine
Try
forearm.
and straighten out your wrist. I want you to resist.
Ask him to flex his wrist against your resistance at the palm.
Good. Same on the other side. Good. Now I want you to take the backs of your hands and put them together, keeping your elbows bent.
Next, perform Phelan's
Some
test.
pressure.
Have the person hold both hands back to
feeling any
back
discomfort in
while
your wrists
flexing
with
his
this maneuver?
wrists 90 degrees. When held for 60 seconds, this position should cause no numbness or burning.
In your wrists. Good.
Also assess
Now
for
I'm going to
Tunnel's
tap
sign
underneath
by
your wrist.
percussing over the median nerve in the
Let me know if you
wrist.
have any pain or
This
discomfort.
should cause no burning or tingling, which is Tunnel's sign.
Okay.
Yes.
Any pain or tingling at all?
No, just a tapping.
Good. Let's try the other wrist. Any discomfort at all?
No,
How about now?
no.
Good. I'm going to examine your hips now. You can lay back.
Although
on the
you'll inspect the hip joints with the spine when the person is standing, palpate the hip joints while he is supine.
side of your hips.
They should feel stable and symmetrical, with no tenderness or crepitus. Next, assess range of motion by having the
Without
person
bending your knee,
perform
I'd like
certain
you to reach your
movements.
Right leg as high as you can.
You should see hip flexion of 90 degrees with a straight knee.
Good. Keeping this leg straight, I'd like you to bend the other leg into your chest.
Hip flexion of 120 degrees with a flexed knee.
Good. Now I'd like to have you bend your right knee, put your foot right on the table flat.
Internal rotation of
Bring your
40
right knee
degrees.
towards me, and now to the opposite side as well.
External rotation of 45 degrees.
We're going to lift your left leg, take it out to the side as far as it's comfortable.
Abduction of 40 to
And then
45
we're gonna take it
degrees.
across your body.
And adduction of 20 to 30 degrees.
Good. And you can relax. Good.
To examine the knees, begin with inspection. The skin normally looks smooth, even-colored, and free of lesions. Assess lower leg alignment. The lower leg should extend in the same axis as the thigh. Observe the knee's shape and contour. You should see concavities on each side of the patella and should find no fullness or swelling. Check the quadriceps muscle for atrophy, which should not be present. With the quadriceps relaxed, palpate the knee, starting about 10 centimeters above the patella. Using your thumb and fingers, palpate down toward the knee, exploring the suprapatellar pouch. The muscles and soft tissues should feel solid, and the joint should feel smooth with no warmth, tenderness, thickening, or nodularity.
I'm going to check your knee for fluid now. You're going to feel me touch the inside of your kneecap.
If you notice swelling, test for the bulge sign. To do this, firmly stroke up on the medial aspect of the knee 2 or 3 times. Then tap the lateral aspect. Watch the hollow in the medial side for a bulge from the fluid wave. Normally, none is present.
For me, please.
Now continue by palpating the tibiofemoral joint, which should have smooth margins and no pain. Also palpate the infrapatellar fat pad and the patella. Check for crepitus by holding your hand on the patella
Straighten the
as
leg
the
for me,
person
please.
extends and flexes his knee.
And bend.
Some crepitus is common.
Straighten. Good. Good. You can
Next,
sit up.
check knee range of motion by having the person stand and perform 2 movements.
You can stand here and hold on to
You
the
should
table
see
for balance.
flexion of 130
I'd
to
like you to bend your
150
right knee.
degrees
Good.
and extension of 0 to 15 degrees.
Good. Now, without holding on to the table, I'd like you to squat down to the floor and
To
stand
test
back
muscle
up.
strength, have the person rise from a squat or from a low
Good.
chair. He should be able to
have some
rise
hand.
without using his hands for support. Then, with the person
Leg against
seated,
my hand.
ask him to maintain knee
Good.
flexion while you try to pull his leg forward.
Very good. Now I'm going to examine your feet.
Inspect the person's ankles and feet while he's in a non-weight-bearing position. Compare both feet, noting the position of feet and toes, joint contours, and skin characteristics. The feet should align with the long axis of the lower legs. Most feet have a longitudinal arch. The toes should point straight forward and lie flat. The ankles should be smooth bony prominences with even-colored skin. You should see no lesions, calluses, or bursal reactions. To palpate the ankle, grasp the heel with your fingers and palpate with your thumbs. The joint spaces should feel smooth and depressed, with no fullness, swelling, or tenderness. Then palpate the metatarsophalangeal joints between your thumb on the dorsum and fingers on the plantar surface. Also palpate the interphalangeal joints on the medial and lateral sides of the toes, using your thumb and forefinger.
Good. Now I'd like to check the mobility.
Test
in your
ankle range of motion
I'd like you to
by
point
having
your
the
toes
person
to the
perform
floor.
various movements. You should see plantar flexion of 45
Point your
degrees,
toes to your nose.
dorsiflexion of 20 degrees, eversion of 20 degrees, and inversion of 30 degrees.
Good. Now I'd like you to bend and straighten your toes.
Also ask the person to flex and straighten his toes, which he should be able to do.
Good. Now push your toes up against my hand.
To assess muscle strength,
Good.
apply resistance as the person dorsiflexes and then plantar flexes his foot. He should be able to overcome your resistance.
Good. And down. You can come down to the floor now. so
With
I
the
can
person
examine your
standing, inspect the spine as well as the hips. Imagine a line from his head down through the spinous processes and gluteal cleft. The shoulders, scapula, iliac crests, and gluteal folds should be symmetrical and equal horizontally. The buttocks should be equal in size. The spaces between the arms and the lateral thorax should also be equal. The knees and feet should align with the trunk and point forward. From the side, note the thoracic curve, which should be convex, and lumbar curve, which should be concave. In pregnant women, watch for lordosis, anterior cervical flexion, kyphosis, and slumped shoulders. In postmenopausal women, especially white women, be alert for a rounded thoracic curve and decreased height, which suggest osteoporosis. Palpate the spinous processes, which normally are straight and non-tender. Also palpate the paravertebral muscles. They should feel firm with no tenderness or spasms. Check spinal range of motion by having the person bend forward and touch his toes.